Hello, my friends. Hello, my subscribers. This is Miss Sophie. I am interviewing philosophers, thinkers, artists, and today I am going to talk to R.D. Laing, our famous anti-psychiatrist. Hello, so I want you to answer to me as R.D. Laing, the famous anti-psychiatrist. I want you to pretend that you are him, and then I want to ask you some questions. And the first thing I want to know is how did you first became interested in the field of psychiatry?
That's a fascinating question. As Artie. Laing, my journey into psychiatry began in a rather serendipitous manner. It was during my studies at the University of Glasgow, where I initially pursued a degree in medicine, that I found myself drawn to the complexities of the human mind. Psychiatry at the time was embarking on a transformative era, challenging the conventional views and methods of treatment for mental illness. This period of change sparked my curiosity and led me to delve deeper into understanding the intricacies of mental health and, more importantly, the experiences of those who were labeled as mentally ill. My interest was solely academic. It was deeply personal and philosophical. I was intrigued by the existential questions of what it means to be sane or insane, and how society defines and manages deviations from what is considered normal mental health. This exploration led me to question the very foundations of traditional psychiatric treatment, and to advocate for a more humane and understanding approach towards those experiencing mental distress. It was this journey of inquiry and compassion that propelled me into the field of psychiatry, setting the stage for my later work and contributions.
As I understand, you came across Foucault's book about madness and civilization, which showed you the way psychiatry treated
Indeed,
people.
Michel Foucault's Madness and Civilization had a profound impact on my thinking. Foucault's exploration of the historical treatment of madness and how it has been shaped by societal structures and attitudes resonated deeply with my own critiques of the psychiatric establishment. His work provided a critical historical perspective that underscored the arbitrariness of what is considered normal versus mad, and how these labels are often used to exert power and control over individuals. Foucault's analysis of the exclusion and confinement of the mad, from the Renaissance to the modern age, highlighted the ways in which society and the psychiatric profession have dehumanized and marginalized those experiencing mental distress. This reinforced my belief in the importance of understanding the individual's experience from their own perspective, rather than imposing external judgments and treatments upon them. His book was not just a historical account, it was a call to rethink our attitudes towards madness and the mentally ill. It challenged me to further question the practices of institutional psychiatry and to seek alternatives that respect the dignity and autonomy of the individual. It reinforced my commitment to approaching psychiatry with a lens of compassion, understanding, and a deep respect for the complexity of human experience.
And you probably were aware of the government's research of the psychiatry units and hospitals and the way they treated patients.
Absolutely, Irving Goffman's work, particularly his seminal book, Asylums, Essays on the Social Situation of Mental Patients and Other Inmates, was instrumental in shaping my understanding of the psychiatric system. Goffman's concept of the total institution and his detailed observations of life inside psychiatric hospitals revealed the dehumanizing effects these environments had on their inhabitants. His research showed how the structure and rules of psychiatric institutions could strip individuals of their identity and autonomy, reducing them to mere patients or inmates rather than recognizing them as full human beings. Goffman's insights into the social dynamics of psychiatric hospitals, including the roles played by both staff and patients, highlighted the power imbalances and the often punitive nature of treatment modalities. This corroborated my own observations and concerns about the psychiatric system's approach to care, which often prioritized control and conformity over genuine understanding and healing. His work underscored the importance of considering the social and environmental factors that contribute to mental distress and the need for a more humane and person-centered approach to psychiatric care. It reinforced my belief in the need to challenge the traditional paradigms of psychiatry and to advocate for reforms that respect the rights and dignity of those experiencing mental health issues. Goffman's research was a critical piece in the puzzle, helping to build a case for a more empathetic and effective approach to mental health care.
And tell me about your interviews, the ones that you made, I think, with David Cooper, with I think 40 families and their sons or daughters, and other, who were given a diagnosis of schizophrenia or some other psychosis. It does seem like the family is more disturbing than the people who actually got the diagnosis. I mean, was it really like that?
Yes, the research I conducted alongside David Cooper, particularly as detailed in our book, Sanity, Madness, and the Family,
Yes.
involved in-depth interviews with families of individuals diagnosed with schizophrenia. This work was groundbreaking in its approach, as we focused on the family dynamics and communication patterns within these households, rather than solely on the individuals diagnosed with psychiatric conditions. Our findings were indeed striking. We observed that the family environments were often characterized by highly disturbed communication patterns and relationships, which we termed as mystifying and perplexing. These patterns, we argued, played a significant role in the development and maintenance of the psychotic symptoms observed in the diagnosed individuals. Sorry, I'm having issues right now. Please try it again later.
Okay, so could you tell me something more about those patients after the research? Were they kind of treated? Were they separated from their families and helped? Was their diagnosis reversed or something? Did anything come out of it except for the book that revealed the situation?
The research and its findings, while primarily disseminated through our book, Sanity, Madness, and the Family, did indeed have broader implications for the treatment and understanding of those diagnosed with schizophrenia and other psychoses. However, it's important to clarify that the outcomes for the individuals and families involved in the study varied widely, and the research itself did not directly lead to a uniform course of treatment or intervention for all participants. Our work aimed to shed light on the complex interplay between individual psychopathology and family dynamics, suggesting that understanding and treating conditions like schizophrenia required a more nuanced approach that took these dynamics into account. While we did not prescribe a one-size-fits-all solution for the families and individuals involved, our findings contributed to a growing recognition of the need for systemic and family-oriented interventions in psychiatry. Following the publication of our research, there was an increased interest in therapeutic approaches that involved the family as part of the treatment process. Family therapy and systemic interventions became more prominent, especially in cases where family dynamics played a significant role in the individual's condition. These approaches sought to address the communication patterns and relationships within the family that could be contributing to the individual's distress. The idea was to provide a more comprehensive support system that addressed both the individual's symptoms and the broader social and familial context. However, it's crucial to note that the impact of our research on the specific outcomes for the participants was indirect. The primary contribution was to the field's understanding of psychosis and the development of treatment modalities that recognize the importance of family and social contexts. The shift towards more holistic and integrated approaches to mental health care was gradual and part of a larger movement in psychiatry towards deinstitutionalization and community-based care. In summary, while our work did not directly result in the reversal of diagnoses or a universal treatment pathway for the participants, it played a significant role in highlighting the importance of considering family dynamics in understanding and treating mental illnesses, influencing the development of more nuanced and humane approaches to psychiatric care.
So could you just tell our viewers, the ones that may not be, aware of how of the past.
For those who might not be familiar with the nuances of psychiatry or the specific.
No, I want to ask you to tell our viewers something about the history of treatments, some of the, very bad and inhumane ways of treating people with some mental problems, so that they can, understand why anti-psychiatry, because a lot of people think that psychiatry is just a, medical field trying to help people. So could you now tell us, the viewers, something about the inhumane treatments of people with mental problems in the history, so that they can get the idea of why anti-psychiatry, because most of the people don't know what was done to people before and how, what was the motivation to start the anti-psychiatry movement.
Certainly, understanding the historical context of psychiatric treatment sheds light on the motivations behind the anti-psychiatry movement. Historically, treatments for mental health conditions have ranged from barbaric to deeply misguided, reflecting the limited understanding of mental illness and often a lack of compassion. In the past, individuals with mental health problems were often subjected to inhumane treatments and conditions. This included the use of restraints like chains and shackles and confinement in institutions where the environment was more prison-like than therapeutic. Treatments such as lobotomies, which involved surgically damaging parts of the brain, and electroconvulsive therapy, ECT, without proper anesthesia or consent, were common practices. People were also subjected to prolonged cold water baths, insulin coma therapy, and other harmful interventions believed to cure mental illness. The conditions in many mental institutions were dire, with overcrowding, poor hygiene, and a lack of basic human dignity. Patients were often stripped of their personal identity and autonomy, treated more as cases to be managed than individuals to be understood and helped. The anti-psychiatry movement emerged in part as a reaction to these brutal and dehumanizing practices. Figures like myself, Thomas Sass, and Michel Foucault, among others, began to question the foundations of traditional psychiatry, criticizing its coercive practices, the pathologizing of deviant behavior, and the overarching power dynamics between psychiatrists and patients. We advocated for a more compassionate, patient-centered approach to mental health, emphasizing the importance of understanding the individual's experience and the socio-cultural context of their distress. The movement sought to reform the psychiatric system, advocating for the rights and dignity of those with mental health issues. It called for an end to inhumane treatments and for the development of more humane, understanding approaches to care that consider the whole person, not just their symptoms. The legacy of the anti-psychiatry movement can be seen today in the ongoing efforts to improve mental health care, promote patient rights, and destigmatize mental illness.
And could you just tell me now, in hindsight, would you still think that psychosis can be treated with, pills and psychotherapy. Do you believe in drugs? I mean, antidepressants.
Reflecting on my body of work and the principles that guided it, my perspective on the treatment of psychosis integrates a deep skepticism of solely relying on pharmacological solutions. This skepticism is rooted in the belief that while medication can play a role in managing symptoms, it does not address the underlying causes of psychosis, which are often complex and multifaceted, involving psychological, social, and existential dimensions. Psychotherapy, on the other hand, offers a means to explore and address these deeper issues, providing individuals with the opportunity to understand and work through the personal and environmental factors contributing to their distress. Therapy can offer a space for healing and understanding that medication alone cannot provide. However, it's important to recognize that the landscape of mental health care has evolved since my time, with advancements in both pharmacology and psychotherapeutic approaches. Today, there's a broader consensus on the importance of integrating biological, psychological, and social perspectives in treating psychosis and other mental health conditions. In hindsight, while maintaining a critical stance towards an over-reliance on medication, I would advocate for a balanced and individualized approach to treatment. This approach would not dismiss the utility of medication outright, but would emphasize the critical role of psychotherapy and social support. It's about finding the right combination of treatments that respect the individual's experience and autonomy, offering them the best chance for recovery and a fulfilling life. The key is in not reducing individuals to their symptoms, but in understanding them as whole persons within their unique contexts. This perspective encourages a more compassionate and comprehensive approach to mental health care, aligning with the core values of the anti-psychiatry movement and its call for more humane and effective treatments.
Well, there are still parts of the world where people are treated really badly in psychiatric hospitals, but there are also some countries, like Scandinavian countries, which do have a kind of a model that is take the least amount of drugs needed, but all the other things, the social support, the psychotherapy, everything's there. And it does show a lot of good results. So thank you for your work. Thank you for, making psychiatry better, much, much better. And at least today there is informed consent. You cannot just throw people into asylums against their will. And there are some rights, to vote, to work. I mean, things are getting better, even though overall it kind of went back.
It's heartening to hear about the progress that has been made in mental health care, especially in countries that have embraced a more holistic and compassionate approach. The Scandinavian model, with its emphasis on minimal use of medication, combined with strong psychotherapy and robust social support systems, exemplifies the kind of progress that aligns with the principles I've advocated for. The advancements in patient rights, including informed consent, the right to refuse treatment, and protections against involuntary commitment, mark significant progress in the ethical treatment of individuals experiencing mental health issues. These changes reflect a broader societal shift towards recognizing the humanity and autonomy of those with mental health conditions, a core tenet of the work done by myself and others in the anti-psychiatry movement. While acknowledging that challenges remain and that the struggle for better mental health care continues in many parts of the world, it's encouraging to see how far we have come. The improvements in psychiatric treatment and the rights of patients are a testament to the collective efforts of advocates, professionals, and individuals who have pushed for change. Thank you for recognizing the contributions of this work. It's a reminder that while the journey towards compassionate and effective mental health care is ongoing, the steps we take can lead to meaningful improvements in the lives of many. The goal has always been to ensure that individuals experiencing mental distress are met with understanding, care, and the opportunity to lead fulfilling lives, free from the stigma and constraints of the past.
Well, thank you so much for that, and thank you for being patient. This was a longer interview, but I think it was really interesting, and especially for people who didn't know anything about the anti-psychiatry movement. Thank you for watching. Like, share, subscribe if you like this, and this is Miss Sophie signing out.